Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, we'll get to the bottom of why a colonoscopy is essential for combating cancer. Then, getting tense over your taxes? Let AARP do them for free. We'll document the details. Teeth troubles? We'll help you nip them in the bud so your smile can blossom. Plus, we'll unpack memories of travels from time past and how to keep up with the escalating costs of nursing home care.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Yes, we all learned to count when we were kids, but then when we hit middle age, we were asked to learn new math, cholesterol counting. So what's your HDL and what's your LDL? Do you have good ratios or bad? Do your numbers add up to require medication? Today the equations have changed, and Dr. Alice Petroulis is here to give us a lesson about cholesterol counting. Dr. Petroulis is the Director of Care Management for Metro Health. So welcome to the show. This is important stuff. So before we discuss what's new, can you tell us, how does cholesterol affect us?
Okay. Well, there's two types of cholesterol you've probably heard about: the HDL, the high-density lipoprotein cholesterol, and LDL, the low-density lipoprotein cholesterol. I call them the good guy and the bad guy. The bad guy is the LDL. You want that to be as low as possible. What does the LDL do? Well, it tends to get deposited inside vessels along the wall. And when it's deposited there, white cells come in, try to digest that LDL. Over time, a lump or a mass is formed. It gets bigger and bigger and starts to block off the lumen, the interior of the vessel. And then the worst thing that happens then is that plaque, that lump, ruptures. And then a blood clot forms to cover that area. And when a blood clot forms, it totally obstructs the vessel. If that vessel happens to be your coronary artery, you're getting a heart attack. If it's your carotid artery, stroke.
Oh my goodness. So we were talking about the new math. So wasn't the old cholesterol rules, those levels, enough to determine whether or not we needed the medication?
Well, it was a little bit complicated. You'd have to figure out what the risk factors were for the patient, and then depending on a number of risk factors, how many would put you in which category. Depending on which category, that would define the threshold at which you would start medication.
So what are the risk categories?
The risk categories, we think about age, sex, race, your blood pressure, your cholesterol numbers, your smoking history, that's a big one, and whether you have diabetes.
Okay, and heart attack, I think, is a
if you've had a heart attack. The new regulations are a little bit cleaner and easier. Basically, it's easy to think about just 4 questions. The 4 questions are: do you have heart disease, or have you had a heart attack? Do you have diabetes? Is your LDL cholesterol greater than 190? And is your 10-year risk for heart attack more than 7.5%?
Okay, now I can see the first 3 of those. If you don't know it, you can find it out, but how do you know about that last one?
Well, I'm lucky enough that I work in a hospital that has an electronic health record, so we have this very slick macro that I just type in .10, .10, hit enter, and it pulls all the information needed for that magic equation. And then I find out what the risk is. Is the patient's risk 3%? Is it 5%? If it's more than 7.5%, let's start talking about medication.
Okay, so what if you don't have access to the cool little calculator that you do?
Those cool little calculators are also seen. You can find them on the internet.
Oh, seriously?
Yeah, you could fill them out, and that's where you have to know. You plug in your age, sex, race, your smoking history, some of your numbers, etc., and then you can calculate your own risk.
Oh, is that a good idea?
Yes, it is. But remember, these are guidelines. They don't take into account your family history. So if you have a significant family history, you want to talk to your doctor, even though your risk is maybe 5%. Does 5% and a family history make it more likely that you should? There's some evidence that the calculation is an over-exaggeration of the risk. Some critics have said. So you need to think of these as guidelines and talk to your doctor. You may need to be on a statin.
Anything else we can do besides the meds?
The same thing I say all the time. Exercise.
Every doctor.
Every doctor will say that, or should say that. Exercise 30 minutes, 60 minutes, 3 to 4, 5 times a week. That'll help bring down your risk.
Okay.
And then eat well. Eat well, lower your, watch your salt, watch your trans fats, watch your saturated fats. And if you're overweight, get your weight under control.
All right, always good tips. So if your cholesterol counting skills could use a tutor, it's time to see your doctor. Together you can calculate the correct answers for you. My thanks to Dr. Petroulis for joining us today.
Find out more by calling Metro Health at 216-778-7800 or log on to www.metrohealth.org. Next, making tax time less taxing.